What is soft wave therapy? When treating a patient, the provider will begin applying soft wave looking for any inflamed or painful area. The pain relief is the result of multiple mechanisms of action, including the modulation of inflammation and neovascularity. Soft wave therapy will always require the least number of shocks, the fewest treatments, and superior outcomes with the least pain, at energy levels that do not cause cellular trauma or injury. Soft wave is the only device that utilizes patented parabolically focused shock waves to effectively treat pain. This technology generates electrohydraulic parallel acoustic waves that provide the largest and deepest therapeutic treatment zone. Soft waves trigger a biologic response up to 12 centimeters from the spark discharge and initiate healing at a cellular level over the broadest possible area, dramatically reducing pain with the fewest number of patient treatments. How does it work? Soft wave's acoustic parallel waves activate cellular receptors, initiating the body's own natural biologic healing response, non-invasively and without drugs or injections for pain. This technology generates electrohydraulic parallel acoustic waves that provide the largest diagnostic and therapeutic treatment zone. Soft wave technology is validated in hundreds of international publications, holds dozens of patents, and is used by leading national and international research and medical centers, as well as major sports team physicians, from NFL, NBA, MLB, and other national sports organizations. Catch the wave and join Team Softwave.
Onychomycosis is a fungal infection that results in discolored, brittle, thickened, or cracked nails. Nails are composed of 3 layers that are uniquely resistant to penetration and make treatment difficult. Topical prescription drugs rarely improve nail appearance, and over-the-counter products are high surface tension, which prevents penetration and successful treatment. The patented Tulsalin antifungal nail renewal solution is a scientifically and clinically proven ultra-low surface tension treatment. This patented combination delivers nail renewal ingredients throughout the nail plate, repairing damage, and antifungal ingredients to the source of the infection, eliminating all fungal species, including yeasts, dermatophyte molds, and non-dermatophyte molds. This novel formulation rapidly renews nail appearance.
suffer from numbness, burning, or tingling in your feet? Peripheral neuropathy can make even the simplest tasks painful. Introducing Nerve Reverse, a natural supplement designed to support nerve health and improve those frustrating symptoms with just 2 capsules per day. With Nerve Reverse, you can reduce discomfort and regain your freedom. Plus, we offer a 100% money-back guarantee, so you can try it risk-free. Nerve Reverse, for healthier nerves, happier you.
Center Franco and Foot Care, we understand the importance of staying active and avoiding invasive surgery whenever possible. That's why we offer platelet-rich plasma therapy, PRP, an advanced treatment that harnesses the power of your body to heal itself. PRP is a regenerative treatment where we draw a small amount of your blood, process it to concentrate the platelets, and inject it into the affected area. These platelets release growth hormones that speed up the healing process and reduce inflammation. PRP is especially effective for conditions like Achilles tendonitis, plantar fasciitis, and arthritis in the foot and ankle. These common issues can cause pain and limit your mobility, but with PRP, you can promote healing without the need for surgery. Our goal is to keep you moving, keep you active, and keep you out of the operating room. PRP therapy offers non-invasive natural solutions to your foot and ankle pain. If you're dealing with chronic pain in the foot or ankle, let's explore how PRP can help you stay active. Contact us at the Center for Ankle and Foot Care.
This is Dr. McGowan showing how we do custom foot orthotics for patients' certain conditions. Like this one is a patient who has hallux limitus. This is a condition where there's kind of arthritic changes in the great toe joint. It makes it painful if there's too much motion in that joint. What we do at the Center for Ankle and Foot Care, we have a high-tech scanning software. We're able to scan the foot, capture the foot like seen here in this image. We're then able to upload these images, place the orthotic on the foot. We're able then to make the modifications. For example, in hallux limitus rigidus, we use what's called a Morton's extension. The Morton's extension then we can just put right on the insert as we're trying to create it for the patient. This is kind of the highest level of customization. We're able to account for the patient's deformity, print the orthotic, which takes a couple hours to print an orthotic when it's this type of intricacy, put the top cover on, and the process is very simple. We scan, we design, and then we print in the office.
This is another great example of how we can help a patient's foot pain when they have a painful callus or intractable plantar keratoma on the bottom of the foot. This patient had one right underneath the second metatarsal head, had been suffering for years. We were able to scan them with our 3D scanner and print these within 2 days. Patient is walking pain-free for months now.